Well, 'tis the season for cold, flu, and RSV, especially in babies. Luckily, Dr. Jennifer Arnold is here with ways to treat these dreaded bugs. What's going on, Jen? How are you?
I'm doing great. It's flu and cold season. It's a yucky time of year from that perspective.
I know. It's like you want to think about the good things and the holidays and all the fun, but it's like, oh, wait a second. There's also some icky things that are happening. And Carly actually mentioned this on yesterday's show. As a matter of fact, Carly's baby, Wesley, was diagnosed with RSV. And I kind of was doing the RSV, I think I've heard of it, but I'm not really sure. What does that mean and why is it a cause for concern?
Yeah, well, RSV is a virus, and it's a common virus that's prevalent this time of year. And unfortunately for babies, it can be very serious in terms of the infection. It's a type of infection that goes into the lungs. It's a respiratory, like a cold. For you and I, if we have RSV, it's just a common cold. But for a baby, especially a baby who may have been premature, and some babies we just don't know why, it can be very serious. It can cause major respiratory breathing issues, fever, congestion, runny nose, but cough. But really the thing you worry about are those babies that might be susceptible to a more serious infection.
Well, I know they said that baby Wesley was old enough that he's not in like the big red flag area, but they're still watching him, of course. Now, they also said when she was at the doctor's office to make sure her two other kids didn't touch the baby. Now that I think I know where they're going, but that's a little difficult. What are some things for people to keep in mind?
So it's really hard this time of year to keep others who are sick away from your babies. But it's important to try to do that as much as you can because that will decrease the risk of the baby getting an infection, which could be more serious for a little tiny one. And the things that you can do are, number one, hand washing. Hand sanitizers are great too, but really hand washing is key. If you're, if someone's sick, blowing their nose in a tissue, don't reuse it. Don't hang on to it in your hands. Throw it away after you've used it and rewash. And just trying to avoid that close as much as you can with other kids. It's hard, right? They want to love on their little baby brother or sister, and that's okay. But when they're sick, you want to avoid that because that's going to increase the risk of transmission. And remember, babies, they haven't had all the immunizations in general that you and I have had, or older kids, so they're more susceptible for other things like, even the flu, right? Flu shots imperative to decreasing risk of flu infection, but babies can't get them until they're about 6 months of age. So.
Well, and we were talking before we started, I asked if your kids had gotten sick yet. You said it was kind of early in the season. You were saying we saw the flu early in the season. What are we seeing now? Still seeing flu cases? Is it a bad case this year? Yeah,
we are still seeing flu, and it did start seemingly a little early for some of us this year. And we're seeing sort of a higher rate of B over A. And so there's, 3 different types of influenza, and B and A are the most common. And B tends to be the one that, makes you a little more sick than the A. We see a lot of kids who are a little bit, higher fevers, a little more sick, a little longer infection rate. And we've had a lot of B this year and early in the season. So I think it's really important, if you haven't gotten your flu shot yet, get it now because it can make a big difference.
I was going to ask, is it too late, the fact that we're already in December?
No, never too late. Get your flu shot. We're still in the middle of that season, and it can last up until the springtime. So never too late to get your flu shot.
And I'd always kind of thought too, down here in Florida, some of our cooler months happen to be January, February, and that's kind of when people get a little worn down more than you see in the northern states a little.
Yeah, it tends to be that our, sort of winter respiratory infections tend to seem to be a little bit on the later end and last a little bit longer into the spring. Maybe it's related to that, but really typically the flus and other viruses like RSV, the reason we're sharing them so much in the wintertime is because we tend to be indoors more in closer contact, and that helps to breed and share those infections.
There you go, putting some light on something that was always like, is it a wives' tale or is it true? Okay, making a little sense. Yeah. Well, as always, we appreciate you. We love when you're here.
Thank you for having me.
You bet, and enjoy the holiday season. I know how busy you are, so glad you're here with us today.
Thank you.
And wash those hands, right?
That's right. Wash, wash, wash.
Hands.